Good morning, my name is Maria, and I'm here with my classmate Nicole, and we're going to go ahead and present about autism. So what is autism? Autism spectrum disorder, or ASD, is a term used to describe a group of neurodevelopmental disorders. These disorders are characterized by problems with communication and social interaction. Now, people with ASD will also often demonstrate restricted and repetitive behaviors and stereotype patterns. And also, ASD affects often more boys than girls.
The subtypes or SPECIFIERS. The first one is with or without intellectual impairment, with or without language impairment, associated with a medical or genetic condition, associated with another neurodevelopmental, mental, or behavior disorder, and with catatonia.
Now, some autism spectrum disorders will be autistic disorder, Asperger's syndrome, the pervasive development disorder, not otherwise specified, or PDD-NOS, and the childhood disintegrative disorder.
What is the cause? The exact cause of the autism spectrum disorder is unknown. The most current research demonstrates that there is not a single cause.
Now, some symptoms for ASD will be that people that had the ASD condition, they're sensitive to specific smells or sounds on their surrounding. They do repetitive movements, motions, or speech patterns. They also have adherence to specific routines or behaviors. They have issues with nonverbal communication, such as trouble maintaining eye contact or reading body language. They also have issues with communication, including difficulties sharing emotions, sharing interests, or maintaining a back and forth conversation. And they also have difficulties developing and maintaining relationships.
Some risk factors are genetic mutations, low birth weight, metabolic imbalances, being born to older parents, a history of viral infections, fetal exposure to specific medications, having a family member with autism, or exposure to heavy metals or environmental toxins.
I'm going to go ahead and talk about the diagnosis for ASD. So people with ASD can sometimes be detected 12 months or younger, and a diagnosis involves several screenings, genetic tests, and evaluations. Some of these tests for autism are the DNA testing for genetic diseases, the behavioral evaluation, visual and audio test to rule out any issues with vision and hearing that are related to autism, occupational therapy screening, and developmental questionnaires such as the Autism Diagnostic Observation Schedule, or the ADOS.
And finally, the therapies and treatment are behavioral therapy, play therapy, occupational therapy, physical therapy, speech therapy, massages, weight blankets, and meditation techniques.
Thanks.